So in technical terms, most of us are looking at the numbers, the AQI numbers. Every day we are tracking them for ourselves or for the city. And whereas some days ago they were going over 500, they are above 300 now. So somewhat better. But remember that this is still above uh, any desirable level. So it's still at a level where people are getting more sick acutely, meaning new problems are happening. And then those who have chronic problems, um, underlying chronic respiratory or other problems, they are worsening. So the immediate effects and then sort of more the long-term health effects of air pollution. Immediate effects, I think we all saw, the public saw, and of course the doctors have been seeing in the past few weeks a rise in the number of patients who are coming into our clinics and hospitals, uh, who are right from never had any problem, young people, young adults at 25, 30, coughing or wheezing or having upper respiratory other issues. Um, the numbers have gone up drastically. My colleagues who work in hospitals and emergency settings are seeing higher numbers of those patients with heart problems and other problems as well. So things like heart attacks, um, more hardening of the arteries, clotting of the veins, something called atrial fibrillation, which is changes in the rhythm of the heart, effects on the pregnant woman, for both her and the unborn fetus. Some varieties of cancer, including bladder cancer, has also been quoted. And there may be some associations which are again being studied, even with things like dementia, Alzheimer's dementia. So a lot of these are not direct one-on-one, studies like we know for many other illnesses where we're able to see, but definitely associations are there, and more data is being accumulated on the long-term effects, on the various systemic effects. So not just one body system, but many body systems. All we as doctors can do is react. When we're treating patients who are coming with a problem, we are reacting to the problem. We are not preventing the problem. We are not giving actually very great solutions to the patient to prevent the problem. That is the work of policymakers. So policymakers hopefully will prevent, and the clinical fraternity at this point can only react and hopefully treat. Something that we can do at the extremes of ages, the young children and the elderly people, if you absolutely have to go out for a walk for other health reasons, then choosing the afternoon time when the sunshine is at its best, let's say about the 1 to 4 p.m. time, might be better. It's warmer. The body has to do less work. Also, because of environmental factors, the pollutants do tend to reduce, they tend to rise. Some other things that you could do, that if you are on medication, you've been prescribed medication, please take it diligently, whether it's inhalers or others. If you've been prescribed vaccines, or even if you haven't, and you're vulnerable, you have respiratory conditions, make sure you're up to date on your adult vaccines also, things like flu vaccine and pneumonia vaccine. So even if you do fall ill, at least the chances of getting superimposed infections come down. Using masks, and unfortunately, really the only beneficial ones are N95, even against, even against pollutants. So if you absolutely have to go out in areas where there's sort of double pollution, construction areas, etc., and you're vulnerable, wear your mask. And limit movement for those who have the luxury of working out of home, not using their cars. Limit movement, stay home, cut down on socializing, so that those who have to absolutely go for work, are able to use transport.